Thank you. And in local news now, conversations are swirling about Medicaid across the country, and there's so much concern in New London that organizers have put together a forum. Local 5's Paul Stino shows us why residents are so fearful about losing their coverage.
The faces of a few of the 1.2 million Wisconsinites on Medicaid. There's David, who says without the program, he could not live independently. And this woman, who says her son has a disability, and Medicaid has given him access to the programs that he needs. These were some of the stories shared at an informational session in New London on Thursday evening.
I think it's important to talk about our experiences and learn to recognize in our community how much this affects people around us.
Recent efforts by Republicans to slash the size of the federal budget has many worried that Medicaid is on the chopping block.
This is about the freedom to live safely in our own bodies. That's not a partisan issue.
Tim Faust is a healthcare coordinator at Citizen Action of Wisconsin and a former recipient of Medicaid.
If I had a $4,000 hospital bill on top of that, which is the average for a 2-day stay, I never would have been able to get out of that hole.
He's seen the impact that Medicaid has had on his life and says Wednesday night was about providing an outlet for people to share their stories, ask questions about what's going on with Medicaid, and learn about resources they can utilize if Medicaid does get cut. Congressional Republicans insist that this will not happen.
The President of the United States has made very clear we are not going to cut benefits for Medicare, Medicaid, Social Security. We're not going to do it. We got to preserve the programs. We just got to make them work better.
In New London, Paul Stino, Local 5 News.
Thanks, Paul. And Medicaid recipients and service providers also met at the YWCA in Green Bay to discuss potential cuts to the program. Officials say the budget resolution passed by the U.S. House of Representatives assigns $880 billion in cuts to the Energy and Commerce Committee. They argue that can only be achieved with cuts to Medicaid. Advocates at the meeting say those cuts could have significant economic impacts, but they also say lawmakers should listen to those who benefit from Medicaid.
I don't think you can talk to them, hear their stories, and not walk away understanding that the system is very efficient, that the system is very fair, that there aren't people on Medicaid who don't deserve to be there. So I would say to legislators, reach out to these people because they've reached out to you and they want to talk to you.
And President Trump has repeatedly said he will not cut Social Security, Medicare, or Medicaid benefits. Governor Tony Evers met this week with Wisconsinites who rely on the Affordable Care Act. The group Protect Our Care got together to talk about how it's harder for families to get health coverage. A part of that is what Governor Evers says is cutting Medicaid funding by over $800 billion.
Cuts to critical programs millions rely on are going to hit Wisconsinites especially hard, including our kids, seniors, pregnant women and moms, rural communities, and folks with disabilities who depend upon Medicaid and Medicare.
Local 5 has reached out to the Wisconsin Republican Party for a response and has yet to hear from them.